There are many substances that can affect the central nervous system, which are called psychoactive drugs. They could be divided into stimulants that increase central nervous system activity, depressants that have the opposite function, and hallucinogens that promote distortions of the mood, thought, and senses. Drugs can affect the reward pathway of the brain in which participates the ventral tegmental area, sending the information of a rewarding stimulus, such as food or sex, to the nucleus accumbens and then up to the prefrontal cortex. Another way that drug use affects the function of the brain is in the neurotransmitters. As we checked in the last video, synapse is the way that neurons communicate each other by sending neurotransmitters. And once its stimulus is complete in the postsynaptic neuron, the neurotransmitter is reabsorbed by presynaptic neuron. With some drugs like cocaine, this reabsorption is blocked, creating a buildup of one neurotransmitter called dopamine, resulting in the continuous stimulation of postsynaptic neurons, though responsible of euphoria episodes in these users. Position emission tomography or PET scan is a medical study to determine the action of drugs in the brain. For example, how quickly they activate and occupy the receptors and how long they take to leave the brain. Also search for knowing the effectiveness of therapies to leave drugs and for comparing non-abusers versus abusers' brain function. They find that non-abusers' brain uses less glucose, which means a minor activity that could cause damage in this organ. There's different stages in drugs abuse that not necessarily present in order or separated. The first one is drug addiction, that is considered as a disease and is the destructive pattern of drug abuse that could lead to not only physical problems but social, labor, or academic. Any substance that could cause euphoria feelings could lead to drug addiction, such as alcohol, cocaine, ecstasy, nicotine, anabolic steroids, cannabis, caffeine, and antidepressants, among others, because people search for the overstimulation of the reward pathway, so the behavior repeats. The effect that they cause is known as tolerance, and it's basically the brain adaptation to increased amounts of dopamine by reducing dopamine receptors, causing that people couldn't enjoy events that previously brought them pleasure, including drugs, making them to consume larger amounts each time. Then we have withdrawal symptoms, that are sweating, vomiting, goosebumps, muscle pain, insomnia, and anxiety, and happen when people stop abruptly taking drugs. Physical dependence is when the body needs the drug to function, otherwise it presents withdrawal symptoms, and the pain could be too strong. But this dependence could be treated by the slowly reduce of the dose through about a week, under medical supervision. This is known as detoxification. And psychological addiction, that is the compulsion to do something because they perceive that as a need. Drugs abuse has several consequences and is frequent in young people because they are more vulnerable to be persuaded. They could be affected with academic problems like poor grades, absenteeism, or dropping out of school. Social and economic problems, such as financial losses caused by inability to support their addiction and themselves, and for greater needs for medical services. This also is related to delinquency and violent crimes. Mental health problems like depression, attempted suicide, developmental lags, short-term memory, learning, and psychomotor skills problems, and all of these could lead to make dysfunctional families. And health problems include injuries from accidents, overdoses, contracting AIDS or another STD for sharing needles, or having poor and impulsive judgment under the effects of mood-altering substances. In general, all of these issues could cause death, but not without having to come with many other life problems first.